Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan. Here is what I bring to you all from the world of medicine. Study finds a connection between cardiovascular risk factors and migraine. Having high blood pressure, specifically high diastolic blood pressure, was linked to a slightly higher odds of ever having migraine in female participants, according to a new study published in the Journal Neurology, which is the medical journal of the American Academy of Neurology. Diastolic pressure is when the heart is resting between the beats. However, the study did not find an increased risk between other cardiovascular risk factors and migraine. Previous research shows that migraine is linked to a higher risk of cardiovascular events such as stroke, heart disease and heart attack, but less is known about how risk factors for cardiovascular events relate to having migraine. This study looked at well-known risk factors such as cardiovascular disease, such as diabetes, smoking, obesity and high cholesterol, and found an increased odds of having migraine only in female participants with higher diastolic blood pressure.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The study involved 7,266 people, male and females, with a median age of 67 years, of whom 15% had previous or current migraine. All participants had physical exams and provided blood samples. They were also asked questions about migraine, including if they had ever experienced a headache with severe pain that affected their daily activities. After adjusting for multiple cardiovascular risk factors such as physical activity as well as education level, researchers found female participants with higher diastolic blood pressure had 16% increased odds of having migraine per standard deviation. Increase in diastolic blood pressure. An increase per standard deviation is a measure to compare the diastolic blood pressure with other cardiovascular risk factors. No associations were found for systolic blood pressure. There were no associations even for female participants with high cholesterol or obesity, and current smoking was associated with 28% lower odds of having migraine and diabetes with 26% lower odds of having migraine. This study suggested that overall migraine is not directly related to traditional risk factors for cardiovascular disease because there are people who are middle-aged and older. Future studies are definitely needed in younger groups of people who are followed for longer periods of time. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.